Well, we got the
He didn't like it. He didn't go out after 3rd grade, and I was like, dang, I wish I went to be. I wish he would have been here until at least 4th grade. Okay, we should. This is my year old coaching. Like the last couple of years, just like 2 kids. And I would, I would coach one too, but I would like help them.
Good evening, everyone, and welcome to the Human Services Career Panel, hosted by the University of Wisconsin-Stevens Point National Alliance on Mental Illness Campus Chapter. My name is Maddy Hensel. I'm currently in my 3rd and final year here at UWSP, majoring in psychology with a human services concentration and double minor in professional communications and substance use and addiction studies. In the last couple of years, I've had the pleasure of gaining extensive clinical experience working with diverse rural populations in nonprofit program development, acute inpatient care, corrections, partial hospitalization programming, and intensive outpatient care. I'm committed to contributing to this field as a researcher and future clinician, currently applying into doctoral programs in clinical psychology. I'm currently serving as this year's Vice President of UWSP NAMI and will be moderating tonight's panel. We have an exciting evening planned with 6 representatives, 4 of which are UWSP alumni from Wood County, eagerly awaiting to share their career experiences with you. We are very excited to have Pointer Studios here live streaming the event for those that couldn't join us in person. They'll also have the opportunity to ask questions virtually through the chat feature. Before we meet our special guests, I'd like to introduce my fellow UWSP NAMI officers to share what our club is all about. Kevin Wald is our current president. Amara Porter is our social media coordinator, and Emma is our treasurer. Kevin will now introduce what UWSP NAMI is and how you can get involved on campus.
Hello, my name is Kevin Wald. I am the current president of NAMI on campus. We are a club that is run with the help of my fellow undergrad students. UWSP NAMI is on campus. It is just one of many NAMI on-campus affiliates across the nation that are part of the larger National Alliance on Mental Illness, which stands for NAMI. NAMI's purpose is to improve the lives of people affected by mental illness through education, support, and advocacy. Education and support are how I first came to be acquainted with the crucial work that NAMI does. Years and years ago, when my younger brother was diagnosed with schizophrenia, my mother and I took family-to-family classes at our local NAMI chapter, led by a NAMI staff member and volunteers who had already gone through the circumstance of having a family member diagnosed with a lifelong mental illness like bipolar disorder, a personality disorder, or schizophrenia. Learning from others who had already gone through a similar circumstance helped my mother and I learn about how to support my younger brother going forward. Finding out that the misinformation and stigmas surrounding schizophrenia were not true was a big boost in hope. I am thankful to this day for that light that guided us through those uncertain darkness. Last year, when I came to UWSP as a non-traditional student looking to earn a bachelor's degree and rehabilitate my traumatic brain injury, I saw a booth for NAMI on campus at the UWSP Engagement Fair, staffed by my predecessor, Lexi. After a brief chat, I knew I wanted to join and get involved. Now, as an officer, I enjoy crafting meetings to help serve the needs of this incredible campus community. We have led meetings this year that included art therapy, inventing your own personal mantra affirmation, creating a gratitude jar, and I look forward to see how NAMI and what we'll come up with for future meetings next semester. Thank you.
Thank you, Kevin, for sharing more about NAMI and how you can get involved on campus. On the back side of the handout, when you came in today, there's a QR code to join our spin page for NAMI here. I recognize my peers in Professor Craig Tim's public relations class that were incredibly invested in helping me promote this event as our semester-long group project. If you're part of the planning process, please stand. I think we've got a couple outside the door. Thank you very much for your help, and I'd like to invite two of my classmates up here to say a few words.
Hello, my name's Maddy.
And my name is Cortland Rush, and we are both classmates with Maddy in Professor Tim's public relations campaign class.
As Maddy said, this was our semester-long campaign project. We worked alongside Maddy and our other classmates to develop marketing materials and reach out to members of the community, such as SPASH students, NAMI community members, and UWSP students interested in pursuing a career in this field.
As a survey, can any high school students that are in attendance tonight raise their hands? Any college students? Yep. And any interested community members by chance? Okay. Then, can anyone who is interested in the field of criminal justice raise their hands? Nursing? Social work? Psychology? Sociology? And substance use studies. Thank you so much.
Alrighty, we want to thank all of you for joining us tonight on behalf of our campaigns class. We are extremely thankful that all of you we are extremely thankful that you all can appreciate our hard work tonight. Sorry, thank you.
Thank you, Margot and Cortland. And again, I really appreciate that PR campaigns class and Professor Craig Tim for their assistance in the event tonight. This evening, we are featuring a group of industry professionals who work in the human services field, including nursing, corrections, criminal justice, social work, and public health. So those of you that raise your hand for any of those majors, you're in the right place. We're pleased to welcome Wood County Sheriff Shawn Becker to speak before we welcome our panelists. Like a few of our panelists, Sheriff Becker is a Pointer alumni, and we are excited to hear from him this evening.
I'm alone. I can prove it. First, Maddy, your classmates, this is awesome. Thank you so much for giving not just me, but the panel the opportunity to speak here tonight on a theme that is extremely important, and that's mental health. And I'll get into that a little bit and how it connects to law enforcement. But first, I have to really, brag about being a graduate from this awesome university. It gave me an opportunity many years ago where I didn't really know what direction I wanted to go, whether it's tech school, military, or the UW. And I'm a SPASH graduate, so I looked at something to stay, close to home. And it was a perfect match. And I have to give a lot of thanks, a lot of gratitude Professor Craig Tim, and I go way back several years. And I really appreciate the opportunity to come and speak at your classes that we've done the last few years. But, other, people that were very influential for me while I was going to, when I was attending school here, from professors, just thinking about our Riley in political science, Professor Miller, Professor Cates, those people that help guide you while you decide what you want to do for a career. I was going between education, law enforcement, and at the time, UWSP didn't have a criminal justice program established through, I believe it's something to do with the DNR and Goyette. It was starting to establish. But the only thing that really connected with law enforcement was political science. And meeting those professors that I just mentioned made the difference. Talking to them about what those courses could apply to the law and law enforcement, and getting the opportunity that really sold me in criminal justice or law enforcement was an internship that political science allowed me to have, an internship in government. And that was an internship with the Stevens Point Police Department. So the foundation that was created by those professors, and then giving that real world experience made a huge difference. And it really brought me here today. So I have a deep gratitude for the people that laid that foundation. And Coach Mish, playing football here, also helped out a lot when you're doing a team sport, along with working with other students that are not only out for football, but anybody else that's out for any sports here, and making those connections. Really, really huge deal for me. So again, deep gratitude for this campus. You guys are all lucky to be here. Enjoy it. It's going to go very fast, even though some days it really might not seem like it, but it will. And you'll be out in the field that you truly love, that I do. Again, having a career that has gone so fast. I've been doing this for over 3 decades now, and I never thought that this was going to be the path that I took, but UWSP provided that. To NAMI, here's the mental health part of things. I owe a deep gratitude to NAMI. Going back and talking about mental health and law enforcement, like I mentioned, when I started the career, there was 0 training for law enforcement officers on mental health. So you can imagine when you're starting a career and then those calls for service, welfare check come up, how do you handle them? I didn't know. And what happened through the years of developing, not just through NAMI, but how mental health was affecting law enforcement. Who was getting that first call to deal with people that are struggling, that are in crisis in the community? Law enforcement was. And we had to make a huge investment in the stakeholders that are helping people through while they're in crisis. And it really came down to communication and working together. And it wasn't always like that. We did not have that great working relationship with our social workers back many, many years ago. But throughout the years, I'm very proud to say that, no, we have a great working relationship. And by doing that, we do affect people in a positive way. We get them going in the right direction. And the biggest thing that I'm very proud of in the last almost 15 years, having that connection with NAMI brought training to our law enforcement officers locally in central Wisconsin and Wood County. We were the first ones to do it in central Wisconsin, bringing CIT to Wood County and crisis intervention team training. Huge. Every single deputy has to go through that training that works for us. And I'm proud to say that we've had 15 classes. It's a 40-hour class, and we have usually about 30 people attend that. So every single one of our deputies have gone through it, and we have about 30. So if you do the math for how many years we've done that, we train close to 400 officers, throughout Wisconsin that come to our class. And that really all started with, getting connected with NAMI and willingness to help not only just pay for it, but provide instructors to come and train our law enforcement officers to deal with people that are in crisis. And to even take off from that is the wellness of our law enforcement officers. Another thing that I hate to say, when I started the profession, there was really no wellness. Wellness for all of our first responders and law enforcement officers. And that's terrible, because if you go through a career and you see things that you see, you have to have an opportunity to deal with them instead of just toughing it up. So another part of what NAMI's done with our CIT training is bring officer wellness to the forefront for us, because people do struggle, and it's okay to struggle. One other thing that I want to mention about mental health throughout the career is what I've seen is the stigma go in a different direction, meaning that it's okay to get help. In fact, it should be celebrated. If you get help on your own, that's a win. That's something that everybody should celebrate. And I'm here to tell you that I've asked for help and gotten it at many different levels, whether it's through our chaplain, a peer support person, a counselor, or a therapist. I've done it all. And I'm very proud that I have. Because if I didn't, I wouldn't be standing up here talking to you. So, NAMI, you're awesome. I really appreciate you guys. So give your own little. Last thing I want to bring up is the jail. You're going to get the opportunity to talk with some people that we work very close with. I talked about stakeholders that we connect with so we can help people while they're in crisis. I think you all probably understand or know, if you look at all of our jails, where do you think a lot of people wind up that are in crisis? Unfortunately, in our jails. And I don't like that. But I also look at it as an opportunity. When you do work with as many other stakeholders that you'll meet, it gives us an opportunity that, people made mistakes in the community. They're going to be an inmate. They're going to do time. But what can we do with them while they spend time with us? And making those investments not with stakeholders, but inmate programming, addiction services. I'm very proud of our partnership with Mid-State Technical College. This Thursday, we're graduating, how many inmates? 7 inmates with their GED, the most ever. And that's awesome. And that's a partnership that we've established with Mid-State. And we've got a lot of partnerships within our community because a lot of people want to help. And I'm very proud of that. So, very proud to be here. I thank you all. I'll hang around for a bit. If there's any questions that you might have for me, I'd be happy to answer them. So thank you very much for allowing me to be here.
Thank you, Sheriff Becker, so much for sharing about your pointer experience, how you ended up in a leadership position in law enforcement, and sharing some of your passion behind serving mental health care in Central Wisconsin. We really appreciate your time this evening. Now, let's welcome our other guests for the evening. I'll begin by inviting our panelists to introduce themselves. Then we'll move into a moderated discussion with questions about their career journeys, insight, and advice for those interested in this field. After that, we'll open the floor to audience questions, so feel free to take note and raise your hand nice and high once we open the floor for Q&A, and we will get you those answers. Our goal today is to give you a real-world perspective on what it's like to work in human services and to help you think about your own next steps. To kick off the panel, I'd like to introduce Dr. Paula Hensel, an addiction medicine nurse practitioner leading the Wood County Jail Medication-Assisted Treatment Program. Paula, please introduce yourself and tell us about your education.
Okay, as Maddy said, I have a doctorate in nursing practice, so for the nurses in the crowd or future nurses, that's my specialty. I hold the triple crown of nursing from UW-Eau Claire. I got my BS in there, my master's, and graduated in their first doctoral program. I also have a biology degree and a chem minor from St. Mary's in Winona. I also volunteered as a firefighter EMT, so I had multiple classes through our local TAC that I attended, which would have been out of La Crosse. Which more do you want? And if you haven't made the connection, Maddy's my daughter, and I see a couple other faces here. I do want to give a shout out to the UWSP women's rugby team, who are part of the top 8 elite in Division III. So congratulations, it was a heck of a weekend.
Thank you. Really great having you here representing the nursing world and how you can get involved in that medication-assisted treatment. One thing that's really neat about our guests tonight is that 4 out of 6 speakers, including Sheriff Becker, completed their undergraduate degree here at UWSP. We're very proud to introduce these alumni and learn about their Pointer pride. Next up is Dillon, the Wood County Criminal Justice Coordinator. Dillon, please tell us about yourself, your role, and your Pointer experience.
Hello. So as Maddy said, my name is Dillon Ksionek. I am the Wood County Criminal Justice Coordinator. I've been in this role for about a year. My career actually started at UWSP. I was a student here. I graduated in 2014. UWSP provided me with a lot of opportunities that I think really shaped where I ended up. I was a sociology major with an emphasis in, at the time it was called crime deviance and social control, which I think now would be basically the criminology minor. I had the opportunity to participate in an internship. I did mine with Portage County Probation and Parole, and that went a long way in shaping the direction that I headed in my career. After graduation, I worked for Portage County Human Services for almost 8 years as a case manager in a correctional, essentially a correctional halfway house. After that, I transitioned and I joined the Wood County team. The jail had installed this new position. They brought a discharge planner or a discharge case manager into their jail. So they saw value in having someone come in and work with individuals prior to release to connect them to community resources and to provide more opportunities for people to be successful upon discharge. So that was how I joined the Wood County team. That continues to be an excellent program that has helped a ton of people. And in the last year, I've transitioned into my current role. So in my current role, I oversee the Criminal Justice Department, which is responsible for helping to coordinate some of the programming that you guys are going to hear about today in the jail. We help facilitate two different programs within the jail, both the medication assisted treatment program and the recovery pod residential program. And then the criminal justice program also oversees the Wood County Adult Drug Treatment Court, if anyone is familiar with those. And then we continue to look for other ways to expand the services that we provide for those that are justice involved.
Thank you, Dillon. We look forward to hearing more about those programs. Our next guest and Pointer alum is Ashley Normington, a public health strategist with the Wood County Health Department. Let's meet Ashley.
Hello, I'm Ashley Normington. As Maddy mentioned, a public health strategist with the health department. I started out my career with a bachelor's of science from UWSP in health promotion wellness and a minor in nutrition. And I had no idea what I was going to do as a career in the field. So I actually started out doing things in the cranberry industry that I had as a summer job in high school and in college. Just continued to do that until I decided to join the AmeriCorps. So I did AmeriCorps for 2 years, and the reason I got into substance use related work is because I had 2 options in the AmeriCorps program. I could either do the after school program or I could do the coalition program. And being that I was also coaching varsity high school basketball at the time, I decided to do the coalition program because I could get done earlier with work. And that is what led me to substance use. I have been doing substance use related work in Wood County for over 10 years now. And it's because of the passion that people in the field brought. So after my 2 years of the AmeriCorps program, they hired me on full-time to be the coalition coordinator for the Marshfield Area Coalition for Youth, where we did upstream youth prevention, so trying to prevent, delay, or reduce youth substance use. In 2017, I joined the Wood County Health Department doing similar work countywide. And during the pandemic, I was one of the only public health individuals allowed to finish writing a federal grant to bring my coworker's position on board to do prevention so that I could shift to harm reduction and recovery supportive efforts. So around 2020 is when that happened, 2021. And I'll talk a little bit more later on about the importance of reduction in the community, as well as building recovery supportive communities. So yeah.
We're happy to have you, Ashley. Our final UWSP alumni member is Emily Primeau, a drug court and strong program case manager who just recently graduated from UWSP and can kind of speak on that transition from undergrad to postgrad. Emily, please tell us about you.
Hi, I'm Emily Primeau. I graduated from UWSP in May. I double majored in social work and sociology with a minor in substance use and addiction. I started with the Wood County Criminal Justice Department as an intern my final year at UWSP, and I was fortunate enough to be hired as a full-time employee about halfway through my internship. A position opened up for me. So I've been there ever since, working as a case manager for drug court and the STRONG program, which is the medication-assisted treatment program in the jail. And I also got my CSW over the summer, so I'm a certified social worker.
Thank you, Emily. I bet it feels great to be back on campus. Our final guest to introduce this evening is Assistant Jail Captain Susanna Wagner. Susanna, please introduce yourself and your position with Wood County.
Hi, my name is Susanna Wagner, and I am a lieutenant or the Assistant Jail Captain at the Wood County Jail. I started my career with Wood County as a corrections officer in 2004. It was kind of I graduated one day and the next day I had a job offer with Wood County. So then as the years progressed, I just kept working my way up and was the first officer promoted within the jail. That was in 2015. So as I started my career, I had noticed that our inmate population was changing, and what we were doing, which was incarceration, was not working. So then our focus began to shift and focus more on mental health and drug addiction. I think that even when I went to school back in 2002 to 2004 at Midstate, the focus was on incarceration with, a little bit. I think we had an hour-long class on rehabilitation. So it was just starting to come out back then, and now we just have been progressively moving forward. So.
Thank you, Susanna. I'm sure we've all noticed by now that there is a little furry sidekick next to Susanna. Can you tell us a little bit about her?
Yes. Lola is our therapy dog for the Wood County Sheriff's Department. She just turned 2 on Saturday, and she has been a pretty important and utilized tool that we do have to. She can make our inmates who are the big guys that are, not so nice, make them cry just by sitting next to them and providing them a little bit of a focus, change of focus for maybe 5-10 minutes. So she goes with me to community events. We go out into the community. We do after-school programming. We do work with our mental health. If somebody in the jail needs her, otherwise she just goes in and out of the cell blocks. We go to the courthouse, through the courthouse, and she greets all the employees when they come in to work in the morning. And this last week we went to Norwood, the mental health facility in Wood County, and she met with some of the residents there in the locked, or I should say secured and unsecured areas. She enjoys the children, and she has them, even when they're going to court, just out in the hallway with them. She gets them to forget about their stressful situation. So.
Thank you. Susanna and Lola, such crucial members of the Wood County department teams. Lola, I saw in a chicken costume on Facebook not that long ago. She sure is fun, and I'm sure she had a valuable experience at Norwood Health Center. I currently work weekends as a therapy assistant on the acute psychiatric admissions unit there. So Lola, such a bright, shining face on the Wood County Department. Now that we've introduced all of our panelists, I have a few topics and directed questions to cover with them. First, our focus will be to help us understand your individual roles a little bit more. So elaborate on your position, maybe tell us what a typical day looks like in your shoes, give us a bigger picture of what your individual roles look like. We'll hand it off to Ashley first, and then we'll pass it down the line.
All right, a typical day at work for me never looks the same. So that's the exciting part about my job. I could be answering emails with community partners. I could be grant writing. I could be doing a Narcan training. I could be staffing our LifePoint syringe service program or working with individuals. Mostly what I do is community work. We try not to focus so much on individual work when it comes to substance use related prevention, harm reduction, or recovery support. We want to work with our community partners to make sure we are making the greatest community impact that we possibly can. So my role is really to support our community health improvement plan. Local public health departments and nonprofit hospitals are required to do a community health assessment and turn that into a community health improvement plan to focus on our community's top health priorities. So for the last several years, mental health and substance use have been identified by Wood County residents and partners as one of those top health priorities. So we really work with our community partners toward a shared common goal to address those substance use related problems in our community in a way that makes the biggest impact. So one of the biggest learning curves for me was accepting that substance use is a part of our world. There will probably never be a world where we do not have substance use, unfortunately. So we need to make sure we are addressing it in a way that works for our community. We cannot do things to people that intentionally will continue to harm them or put them in a worse off position. We want to make sure we are recognizing that everyone is a part of our community, whether they use substances or not. So that's really the learning curve that I really had to get over, because that was not my mentality going into this role. I didn't understand that. So it's really been a shift in thinking. So I get to do a lot of fun things in my role. I get to research substance use trends. I get to track data. I get to do those fun trainings with our community partners or hold meetings, things like that. So it's one of the things that I just love about my position, is that I can kind of make it what it needs to be and work with the community. I love working with the community.
Thank you, Ashley. Lots of adaptability, research, a lot of data involved there. Thank you. We'll pass it over to Emily.
I will start with the STRONG program, which is the medication-assisted treatment program in the jail. Every day I have to go into the receiving part of the jail. So when you're first booked in, you go to receiving. And I deliver screeners to every single person who comes in the jail to screen for substance use disorder. So I give out the TCU-5, the audit, and the ORSA, which is the overdose risk assessment. So if inmates are interested in substance use recovery, they fill those out, send them back in. When they send that back in, we see if they're qualified for MAT, or we have the recovery pod as well. Most people who get on MAT, they're eligible to meet with the case manager. So me and my coworker, we go in and meet with people however often that they want to work on some of their recovery skills and develop some of those skills for when they get out in the community. Whether that be like coping skills, healthy relationships, or setting boundaries. And then when we get closer to their release date, we do more intensive case management. So that would be setting up appointments, coordinating community referrals for them, so they're all set up when they get out. And then with drug court, we have drug court every Monday. So basically most of that morning we spend preparing for court, gathering all the paperwork. We make staffing sheets for every participant in drug court, so it just has a summary of what they did for that week, what treatment they did that week, and just ensuring that every participant completed the requirements that they needed to, as well as seeing if there needs to be any treatment response or potential sanctions for missed requirements. And with drug court, I meet with people once a week, bi-weekly, or monthly. It depends on how far they are in the program. And with that, we work on a case plan, so it identifies some of their high-risk, high-need behaviors, and just kind of helping them get more settled as they grow in their recovery in the community.
Thank you, Emily. I know as someone in that substance use minor, we talk a lot about those screeners, so this is real-world proof that learning those acronyms in our classes here in undergrad will definitely be able to apply those. Dillon.
So the life of a criminal justice coordinator is kind of complex. I guess my first responsibility is to be an administrator. So I oversee multiple programs. I oversee 4 different grants. I have responsibilities with those grants. We have to essentially state and federal funding is provided to help support our programs. It's my responsibility to make sure that we are reporting the necessary statistics that the state and federal government want to see. It's my responsibility to make sure that the invoices are getting paid, that the contracts are done, that the services are being provided as we've highlighted them in the grants. I also oversee the staff that run each of these programs. I guess at a bigger level, the criminal justice department, our responsibility is to kind of be the intersect between all the different pieces of this world. So we work hand in hand with the jail, with law enforcement, the health department, social workers. The prosecuting attorneys, defense lawyers, we're supposed to help provide opportunities to individuals who are justice involved. I mean, that's our role. So we provide those opportunities through these different programs, but none of those would be possible without the help of our partners. In some ways, I'm essentially a high-level coordinator in that I have to coordinate these services. So the jail is very open to programming. The sheriff's department is very open to programming. And part of my role is to make sure that we're offering the best programming we can, seeking out other programming opportunities, other funding opportunities to maintain that programming. I think a lot of what I do on a daily basis is similar to what Ashley said. It changes. I'll spend a whole day working on a grant report. I'll spend the next day working on a new diversion program or looking into other opportunities the county could pursue. I spend time in drug court. I have a role on the drug court team. My role is to be aware of what the industry standards are, what the best practices are, and then to share those with the team members to make sure that everyone's on the same page with what standards suggest would be best practices. My role changes so much from day to day. And then if any of my staff are gone, then I have to be able to do what they all do. So there are days where I have to be a drug court case manager, or I have to go into the jail and deliver screeners. So in a lot of ways, it's hard to nail down what a normal day is, because my normal day is always changing because it depends on what's the highest priority that day.
Every day is different.
Okay, I think I need to backtrack a little bit, but I will spare you all of the 30-some years of career I've had. But I had somebody once ask me, when did you first start this line of work? And I'd have to go all the way back to my very first ambulance call when I was not even 18 years old. There was an intoxicated driver who hit the back end of a parked car. And I tell people that the mental health work that we do, the substance use work that we do, no matter what career path you pick, you're going to have this experience, whether it's your family, your coworker, somebody you're working with, customer, no matter where you are, this area of specialty is going to impact whatever you do. I've worked in lots of different settings. I've worked in ERs, I've worked in public health, again, the 911 response things. I've done primary care, urgent care, and it all influences how we operate and what we do to help our fellow man. I got into addiction work about 10 years ago and just recently certified as an addiction medicine nurse practitioner. A typical day for me, I have a couple different roles in my career right now. I work with Ashley as a kind of content expert and a next of kin interviewer on our overdose fatality review team for Wood County. What we do is we look at different cases in our community that have been cleared by the prosecuting attorneys, district attorney's office, and the officers involved, so that we can look at what happened, why, and is there anything we can do as a community to maybe bring awareness or look at policy. I think Ashley's going to talk a little bit more about our policy work in the future here, but that's my work. And the next of kin interview part is talking to the family. How did this person get here? Was there anything they thought society could have maybe done differently or helped them? What resources were or were not available? In my role at the jail and in criminal justice, I'm the, again, medication-assisted treatment nurse practitioner. So I provide the medication to people who are in the jail, help them get connected to resources. A typical day for me usually starts around 6:30 in the morning. I come in, I take a lap through holding to see if there's anybody in acute withdrawal. And after that, if there is, I'll ask if they've had a urine tox screen done so that we know what's in their system. Kind of plan my day from there, go upstairs. I do help our nursing staff. So back to our nursing students in the audience, if you ever have an interest in correctional nursing, come talk to me. I can certainly get you an internship or at least a shadow for the day. But I do help the nurses pass the medication at this point. It also allows me to have day-to-day interaction with the people who are on the treatment medications. How are they doing? Are they tolerating the medication? Is it doing what they thought it was going to do, and how do they feel? I do have to work through a lot of education. Sometimes they don't know what the medication should be doing for them. Education to my people, my patients, about, their addictive thinking. Talk a lot about kind of their beliefs and perceptions and their culture. For many of the people I work with, they're not the first one in their family, it's generational. So we spend a lot of time talking about that. I pass meds in a group, they support each other. After I get the medication passed, I may have some new people to interview and take their history and decide what treatment path is best for them. I may be starting medication that day because they're in acute withdrawal and they need a medication called buprenorphine, which helps address their opioid dependency. Or it may be that they have an alcohol use disorder or a combination of alcohol and opiates. We start another medication called naltrexone. We talk about Narcan and its value, and I know Ashley does a lot of work about Narcan and distribution. I mean, you can't hardly turn a corner in the courthouse without finding Narcan waiting there for you just to pick up and take out and have available in the community. I'm on drug court with the rest of the criminal justice department team, and kind of a content expert, I guess you would say, as to what is going on with that person, what may be beneficial for them as far as a treatment option. Can they do it in the community? Do they need to go to residential? Things like that. Are we meeting their needs is my role. Before Dillon took his position, I helped with some of the grant reporting and things like that, but he was a great boss. When I ask him questions, my favorite line out of his mouth is, "Whatever makes you happy, Paula." Best boss ever. And I didn't find him till almost the end of my career here, but we do work together in some of the reporting, and I think that's got some time from us tomorrow. We got to work through some of that stuff. So.
A typical day for me, obviously there's no typical day because my day depends on what is going on in the jail. So I do have my basic job duties of overseeing the staff, and we have the kitchen, dietary department, and then mental health. We have 60 hours in the jail currently of mental health services, and we have medical, So my day is also consists of in relation to these guys here, it's getting what they feel is more, they do the assessments and what they feel is what's best to meet the needs of our inmates. So then it's my job to try to make that happen to fit within the jail setting. So we work together to maybe get programming in that they feel is necessary for even one inmate or maybe a group of inmates. So I feel that my job is unique in a lot of ways because we are able to allow all this the programming to come in and meet the needs of the inmates.
I'm noticing kind of a pattern here. We're working together. We're meeting the needs of people, collaboration, working within the community, trying to figure out what is best for everyone, and that every day is different. So if you're someone who's looking for a little taste of something, kind of like having that adaptability piece, definitely the field for you. Paula, you kind of touched on this, but I'll have you start us out with the next round here. We'd like to hear a little bit more about what made you pursue this career field. So us as undergraduate students, we're kind of going through that, what do I do? I may have picked a major, some of us haven't. Where do we go from there? Kind of what helped steer you towards this field? And we'll start with Paula and then pass it around.
So as I thought about this question, and after listening to Sheriff Becker, wondering, kind of got these things that I want to do, and how am I going to get there, and where am I going to fit? I think my best word of advice to you is never say never. When I graduated nursing school, I had already spent a lot of time on an ambulance, worked in the ERs as a tech, and I'm thinking, I'm going to live and die in the emergency room at Marshfield St. Joseph's Hospital. I'm never going to work in a nursing home. I am never going to work in a psych unit, and I am never going to work in OB or NICU. 2 out of 3 I've done and loved them both. I still can't do the baby thing right now. Mine were fine, but that's just an area I didn't find any joy in. So I tell you, never say never, and because you may shut out an opportunity that you didn't know you were going to enjoy and find passion with. So as I was working on my doctorate, I needed a capstone project. Anybody in the room working on any sort of big project like that to graduate? Yeah. I was working in urgent care, and I noticed this trend. Fridays at 5:05, we'd have a whole line of people because the clinic hours were closed. Their primary care provider, their specialty doctor were now out of the office, and they needed a refill on their prescription. And it wasn't their thyroid medicine or anything else like that. It was for a controlled substance, because without it, I'm just going to die. And typically opiates. And finally I went to my boss. I said, what's going on? We got all these people that come in at 5:05 on Friday that want a controlled substance. And it's not really appropriate. They knew it was coming. How are we going to do this? And I needed a capstone project. So we started talking about it. He's like, you need to go talk to Dr. Kral. He oversees this kind of work in the clinic. And I did. I met with him and I said, what's going on? We've got all these people that just want prescriptions. And something that at my house I would have said, put a Band-Aid on it, you'll be fine, go away. People were coming in and I could glue it or put one little stitch in it and they would want, take a guess? Opiates, she's whispering. So they would want an oxy, or they'd want 10 oxy, or they'd want Vicodin or something like this. And I said, this is out of control. We are creating a problem in our community. What are we going to do about it? So I had taken this presentation to UW-Eau Claire School of Nursing, the dean, and said, I want to do this project. What are we doing as the white coats, as prescribers? As far as our prescribing habits, I think we're creating people with a substance use disorder. And they're like, yeah, we really think you should look into that. Clinic was on board, went all the way through, and after I got my approval, 2 nights later, there's President Obama up there on the news saying, hello, United States, we have an opioid addiction problem. And I'm like, sweet, I have a very relevant, pertinent capstone project. And I ended up doing some presentations across the state, and I got a phone call from Sheila Wykes, who was the director of substance use services for Family Health Center, and said, "Are you interested in the job?" And I said, "I don't know a thing about treating substance use disorder." And she said, "I think you know more about it than you think." And looking back from day one when I entered a caring profession, nursing, at whatever level, we truly do work with folks who have mental illness and substance use disorders, and that's where I ended up where I am today. I did about 8 or 9 years at Family Health Center, decided I was going to retire for a little bit, and then the opportunity came at the Wood County Jail to step into a grant-funded position as the MAP prescriber for the jail.
So this is a difficult question for me to answer as far as what made me decide to pursue a career in this field, because it's a very complex answer. But I guess in thinking about this, I tried to summarize it the best I can. And the easiest way to do that would be to say that when I was growing up, I was surrounded by a lot of the substance use, mental health, domestic violence, some of the things that come up a lot when you look at the criminal justice field. And I had firsthand experience with this system, and I didn't like it. And I think that was really what motivated me to go in this direction. Was I didn't like what I saw. I didn't like what I saw necessarily from the community corrections world. I didn't like what I saw, and it wasn't so much that I wanted to change it. I mean, it would be nice, but I think what really motivated me was I wanted to provide people that were in the system or criminally justice involved individuals with hope that there were people who wanted to give them opportunities, who wanted to be there for them, that genuinely cared about them. But most of all, I just wanted to see a world where there were individuals in this field who treated everyone equally and treated everybody as people. I've been very blessed in my current position in Wood County that I think there's a lot of people that view it that way. There are a lot of people that, Susanna said it earlier, that a lot of people that recognize that what we're doing isn't working or wasn't working at the time. And I do feel very blessed to be part of a bigger team now that sees value in that and sees the value in challenging the status quo and in pursuing opportunities that genuinely benefit the people that we should all be trying to help. So I guess that's the short answer to a much longer story.
I got pretty lucky going through college. I started as a social work major, and I only added on to that with sociology and substance use. This is also a really difficult question for me, and like the simplest answer I can say is that it just feels right. And I did some thinking about this today, and I would say kind of similar to what Dillon said. There are a lot of barriers in the justice system, and we can kind of all see that working in this system. And just being able to empower people to make decisions in their life to better their futures and kind of achieve their full potential while also navigating a really complex system that doesn't often work in their favor from time to time. And also learning about like the code of ethics for social work and just the idea of connecting people to resources was just something really exciting for me. Yeah, this is another difficult one, but I would definitely highlight, the barriers that the people that we work with face every day. We're going in and out of the system, and just trying to stop that cycle for them as well.
All right. I kind of talked a little bit about this already, but what made me pursue this career field? Fate, I'll be brutally honest. I came to Point to play basketball, and the education piece was more of an afterthought for me. So, being brutally honest, I did not declare a major until my second semester of my sophomore year, and just kind of chose one that seemed to align with what I wanted to do. Although I had no idea what I wanted to do with health promotion wellness, I didn't know what sort of career
too. We talked very little about substance use in any of our college courses. I remember one of my professors, she kind of challenged us in one of our classes to say, when you go out drinking, which no college students do that, pay attention to how many drinks you have, and not just your drinks, but how many servings are in that alcohol beverage. So she told us to keep tally marks on our arm. And that was one of my first experiences with harm reduction. And I didn't know it. Was my college professor saying, keep track of your drinks. So that was kind of a cool thing that looking back on and reflecting on it was like, okay, so I did get a little bit of harm reduction education, which I feel like that's really missing. Even in elementary, middle school, high school, we can't just tell kids say no to drugs, because when we tell them drugs are bad and you're going to die if you use them, and then they use them and they don't die, and it actually feels really good because that's what drugs are supposed to do, they don't trust you anymore. So that's an interesting topic for another day. I won't go down that bunny trail, but just having passion for what I do and working with people who are passionate about what I do really makes my job unbelievable. I love being able to feel like I'm making a difference in my community. So getting to do exactly what I feel my community needs, where I'm raising my children now. I was born and raised in Wood County, and now I get to try to make the community better. And that's just a wonderful thing that I always wanted. So that's my best answer to that.
And we'll hop back down to Susanna there.
So what started me out in this field was I took a career awareness class, and I had to I couldn't figure out what I wanted to do. So I scored high in protective services and ended up in corrections because law enforcement was full. So I figured I would start out in corrections, get in the field, and then go back into law enforcement. However, when I got into the jail, I realized that I could make a difference in the jail, and you just realize that, well, I could be there and not get, and I could talk to these people and treat them like human beings. And, you know, bad part about it is, yeah, we do go hands-on with people, and most of the time they are under the influence. But then I could go back the next day and just ask them how they were doing, and a lot of them were, you know, willing to share but apologetic, and you realize that normally they wouldn't be acting this way if they were not under the influence. So then we come down the road just a little bit further, and we realize that, you know, it's not just this instant, and it's not just, you know, the crimes that they're committing, but they're hurting their families. So we realized that we needed to start doing something different to make a difference in these families and the communities, and giving these families hope, so we could offer some programming and some mental health services. The other part to it is the offenders coming in, you know, the repeat offenders, and they just keep coming back, and they would come in and, you know, they would just be crying and no hope for the future, just defeated by this addiction issues. And so being able to offer this programming in the jail now is something that, you know, I feel like I'm giving back to my community. And it's not always glamorous, of course, but working together as a team and being able to offer hope is probably why I stay with the job that I do.
I'm just going to jump in here for a minute. I hope that you're beginning to see how we all work together. We've got Ashley out in the community doing that prevention piece and that initial work and prevention. Emily comes with the screening and intake, triages to me what people see on those screeners that you're learning about and applying, beginning to apply to your work. And then Susanna and I, when we first started working together, she's like, I wonder what this is going to be like, because it truly is two different worlds. When you're in medicine, your goal is to help people feel better and keep them alive. And it's really a mind change. We talked a lot about this, about corrections. You just put people in jail, and that sheriff said the last 15 years we've really made a lot of shifting from just lock people up and walk away, and when their time is done, run back out in the community. Case managers work with that transition from you've been incarcerated for months, you worked with a medical provider, we were able to stop your withdrawal within hours if it's an opiate withdrawal, and start thinking about, gee, I can work with these cravings and urges and the physical ick, the withdrawal, and feel better so that we can start thinking about how things can be different on the outside. Case managers make those community connections. Susanna has worked to bring many of the outside agencies in. We have peer recovery, we have different counseling coming in to help people and make that transition back out into the community. There's AA, NA, multiple different resources so that people can now leave jail with a better plan than just 4 o'clock in the morning, see you next time. So things have really changed in the last few years.
I really like how each of our panelists kind of has a different path that ended up in the human services career fields. And I was kind of the same way. I graduated high school, did not have much of an idea. I graduated back in 2023, and just in the last couple years here, for me, it was the hands-on opportunities. I thought I wanted to be in education. I had graduated from high school, so that was the world that I was in. All I'd ever experienced was that education piece, being a student. Shadowed in high school with a first-grade classroom and absolutely loved it. Looking back, I loved the people piece. I like being able to bring hope to people, help these students, and really kind of be that helpful person in their life. That helpful piece kind of stuck with me. I then transitioned into more of a comm field where I wanted to help communicate with people. And then by my fall semester last year, I had kind of made a common theme. I was only taking psych classes. Hadn't really gotten into too many of the comm classes, and by then it kind of opened my world. I had gotten some hands-on experience spending this last summer with the state of Wisconsin Department of Corrections as a probation and parole agent just north of here up in Wausau, Marathon County, and then having worked at Norwood, the health center in Marshfield on the psychiatric unit. Having worked in nonprofit, working with kids, foster kids that needed some extra love and hope in their lives. For me, it really came down to the hands-on experiences. So as we continue tonight, I really encourage our undergraduates here to think about some of the key terms, key storylines of our panelists here, and how we can apply this to kind of figuring out what our next couple years look like and how you want to proceed. Like I said, for me, it was that common theme of helping people, and that's where I ended up. We're going to move into some more directed questions before we open it up to Q&A. So again, keep your questions in mind. We're going to open up the floor to questions in just a few short minutes after talking to each of our panelists again. We're going to shift it over to Susanna. One very unique thing about Wood County is the brand new jail. As assistant captain, you oversee this location. Can you explain some of the features of the jail and improvements for the people in your care?
Sure. I mean, I think that I should just start out with everything is completely different than what we had in our old facility. We had a 132-bed facility. We were housing at over 125 in our facility, and we were still housing out maybe around 100 inmates out to other facilities. So another unique thing that we had was that our inmates who were in other counties were not receiving the same programming because they were not eligible, or the other counties that we were housing in did not have the substance abuse or the same needs as our inmates did that we were sending and housing over there. So when our new jail was being designed, it was designed with the along with programming. We currently have 4 programming rooms on the second, third, and fourth floors. We have programming coming in throughout the entire day. We kind of designed a program that would meet all of the needs of our inmates, and we are able to offer a lot of different types of classes. So we even have finance coming in, we have church communities coming in doing Bible-based recovery groups. We have 3 Bridges coming in. I don't know if you guys are familiar with them. We also have a lot of the groups coming in that do the programming, and then the programming is continued once the inmate is released. So it goes hand in hand. And we also have the family center. So we're meeting all their needs of mental health, their medical, physical, religious, and relationships. So our old jail, we had 1 room, and it was probably a very small room, and we use that for all of our programming. So we've been able to just expand and grow with all the volunteers that come into our facility.
Yeah, it's such an incredible new facility. Really unique to see up here in rural north central Wisconsin. We've mentioned the recovery pods and medication-assisted treatment. I'll pass it back over to Paula and Dillon to kind of piggyback off of each other and explain a little bit more on their program in just a few minutes.
So I already mentioned my job is to assess our inmates as they come in for any medication needs that they may have to help treat their substance use disorder. Really started our treatment program at the end of January, very early February. And so far I have impacted, when I looked today, it was about 130 people that have received medication and were released to the community with some sort of continuity of care. So they continue the medication while out in the community. Again, this is a leap from where we were before. I think Wood County, particularly for rural counties, is leaps and bounds ahead of other facilities. We've had people leave our facility and get transferred to another county, and their medication is stopped because they don't either have the resources or it's not accepted at that county. So I really give Susanna and Ted the captain and Sheriff Becker a lot of credit for being cutting edge on how substance use disorder can be managed in the jail setting. The people that we work with have said that they appreciate it so much because they are feeling better. Their cravings are managed, their withdrawal symptoms are managed, and they're able to leave with a clear head and a community connection. We do offer all 3 types of MAT in our jail. We have a partnership with Wausau Comprehensive Treatment Center out of, again, Wausau, where we are able to get their methadone brought into the jail and we do administer it. I prescribe the buprenorphine or Suboxone subs is what you may hear people talking about, and then also naltrexone and the Vivitrol injection. So all 3 types of recognized and FDA-approved MAT are available in our jail. I'm a firm believer in holistic care approach in that I just don't give people medication, that they need to also work with counseling, peer support, our case managers to really get that wraparound and give them a solid base to get back into society and move on with their life and hope. You've heard hope mentioned several times, and I think that's really that critical piece. And many times I hear people say, you treat me like a human being. And there's a lot of stigma. They do all-day seminars on stigma, sometimes multiple days of perception of how they're treated by people in the community who don't really understand that substance use disorder is an actual diagnosis and a medical condition. I've done some teaching over the years with my peers, my colleagues, of this is what's really going on, and to help them have a better understanding. I've seen some pretty terrible things come out of other healthcare facilities in the words in their discharge summaries and things like that. I had patients when I was in an outpatient clinic who would go in with a sprained ankle. I'd get their note, and the whole first paragraph was about their substance use disorder, and they've been in sobriety for years, sometimes a decade, and that was the focus. And that's just stigma coming through. So lots of work to be done out there, but helping people find their value and that they can be productive citizens. And a lot of that has to do with their own self-worth and working through a lot of it. So I could talk for hours. I'll pass it over to Dillon.
So the other big jail program that we're involved with are the recovery pods, and that was actually something that started off before the criminal justice department got involved. So several years ago, Three Bridges Recovery and the sheriff's department and the jail, they partnered to make those a reality, and it started off with a group. So peer support, recovery coach individuals were coming into the jail. They were going through individuals were going through an application process, and then they were put in a separate pod in the jail where they could focus on recovery, where they could have access to their 12-step meetings, to their recovery coaches, and to some cognitive behavioral intervention programming. In the new facility, as Susanna had said, the opportunities for programming increased significantly. And we also were able to secure some funding through a state grant that allowed us to expand some of those services offered. So the real goal at this point of those recovery pods or those treatment pods is to provide as many modalities of treatment as we can, because recovery looks different for everybody. So as Susanna said, there's a number of partners that come in. We have programming that focuses on cognitive behavioral intervention, trauma. We have, at different times, we've had access to one-on-one counseling. Originally, the way the recovery pods were designed is that there was a clinical therapist that was actually coming into the jail and meeting with people individually. We offer 12-step programming. We offer smart recovery, which is another, group or therapy of sorts. But it's not really therapy. It's support. It's similar to AA or NA, but without the religious component, and it's for everybody. It's not just for individuals who identify as alcoholics, or it can literally be smart recovery. It can be used for anyone that's in recovery from any addiction, which is really interesting and makes it very unique. We've also been able to utilize some of that funding to provide smart recovery in the community as well. So the recovery pods are just unique in that they allow us to use all these different modalities of treatment, including the medication-assisted treatment that Paula was just talking about, because individuals are in custody, that they are being held accountable for actions that they made, but that doesn't mean that they should not have the opportunity to receive treatment or to receive an opportunity to better themselves. And that's something that the Sheriff's Department believes in, and that's something that we believe in. So we've been partnering to try to offer as many opportunities for recovery as we can, obviously in a controlled environment, but that's been kind of the mission with those.
And then tagging on to that, Emily, you get the opportunity to work with treatment court. Can you tell us a little bit more about that?
Yeah, so it's an alternative, in simple terms, like an alternative to the traditional court system. So basically, with drug court, we can get two types of referrals. So an ATR, alternative to revocation. That's basically if somebody had drug-related charges in the past and were put on probation, they were violating some of the rules, or just weren't following the requirements of probation, they can potentially get revoked. So that means they'd have to go back to the traditional court and get their full sentence, if that makes sense. So drug court is an alternative to revocation. So basically, there is 5 phases in drug court. Each phase is 90 days. When you first start drug court, it's the most intensive. So it's the most supervision, most case management, treatment, court appearances. And then as you complete the requirements and are getting what you need done throughout the program, those restrictions, they kind of lessen over time. We can also get referrals for individuals who caught new drug-related charges. So if they go and complete drug court, they can get those dismissed. So basically, with the alternative to traditional court system, it's them being able to work on their recovery in the community while still being held accountable by the court. So with that, every week they have to meet their requirements, like going to treatment and supervision and all that. And if they complete all their requirements, they get incentives. So what we have is there's a fishbowl drawing. So I think it's like 3 times a year, 2 times a year. 2 times a year, we have these big drawings where there's a bunch of cool prizes that participants can get if they complete all their requirements. We also have like a little candy prize bucket that people get. They can pick a prize if they complete all the requirements. We have quarterly passes. I'm trying to think. There's a lot of different incentives that people get when they do complete all the requirements. On the other end of that, they do need to be held accountable for what they do in drug court. We try our best to be as supportive as we can, like Dillon said, with the standards of drug court. We like to follow those and best practice, but people do mess up, and it kind of depends on where they are in their recovery, and that correlates with their phase in the program. So we also come up with sanctions for that, and that could be treatment responses or court responses to correct that behavior.
Yeah, Emily, Dillon, Paula, and Susanna kind of just went over the different programs being offered by Wood County: treatment court, recovery pods, medication-assisted treatment, education programs, community-based support programs, all incredible resources for the people in their care. We'll shift gears a little bit here. Emily, you are a recent post-grad, and a lot of us are looking at this looming thing of graduation. Can you tell us a little bit how that transition's been and what that's looked like for you?
Yeah, I was pretty nervous going into my last year at the university. I thought I wasn't going to get hired anywhere. I had different plans like across the state that I was going to pursue. And Dillon convinced me to stay, luckily, because there was a position open while I was interning with the Wood County Criminal Justice Department. So I would say career-wise, that transition was pretty smooth because it was just going from intern to full-time employee, but my responsibilities definitely were more intense with that because I wasn't an intern anymore. I actually had to take on my own clients, and life is a lot different than the case studies that you guys read in class. So for words of wisdom, I would say be open-minded. Don't assume that you know everything, especially with specifically with individuals in the criminal justice system. Don't assume that you know anything about them or what they've been through or anything like that. And just ask questions. You'll never get more than they wanted for themselves. And it's kind of taking that step back and just remembering the bigger picture with things. And also be patient with yourself. I still make mistakes. Obviously, I just graduated, so I'm still working on it. But be patient with yourself, and it'll all be okay, and things will fall into place the way that they should after you graduate.
Thank you, Emily. I really like what you said about ask questions. We'll open the floor in just a minute. Take this opportunity while we have these industry professionals here to ask those questions that you have. Ashley, you have some really unique work experience with the harm reduction and policy work. I actually, as I was brainstorming up this panel, I was sitting at the Wisconsin Substance Use Prevention Conference, watching Ashley and her colleagues present on their current work, and it was so neat to hear about, so I'll let her elaborate on that a little bit more.
Sure, that session in particular was on Wood County's hemp ordinance, because Wood County was actually the first in the state to place an age restriction on intoxicating hemp. And that all came from the 2018 Farm Bill that was signed into law that essentially made any intoxicating hemp legal
here in the state of Wisconsin, completely unregulated. And so I had been to a couple of trainings where there was one training in particular where the presenter said, if you're not seeing these products like Delta 8, Delta 10 in your community yet, you will be. And so that was in Wausau, and in between that training, I went to a smoke shop, is what I'll call it, with one of my coworkers from the community that I work with. And sure enough, we saw something called shatter being sold on the floor at this smoke shop. And I'm like, wow, I never imagined that I would actually find something that he was sharing about in the training. And so we actually did some community scans in Wood County just to see what is being sold and how it's being sold. And one of the shop owners at the time, I will never forget it because I have children at home and my oldest son was 8 years old at the time. The shop owner said, when we asked about how old you have to be to come into his store, he said, well, I let kids in here all the time because I sell other stuff too, but I wouldn't sell to an 8-year-old. And I was like, wait a second, would you sell to a 12-year-old or a 13-year-old? Because this is basically that individual saying I wouldn't, but he can. So being that these intoxicating hemp products are completely unregulated, that means no age restriction. That means they're not tested anywhere for potency. That means as long as it's not Delta 9 THC, which is the primary chemical component that gets you high in marijuana, it can be as strong as you want it to be, right? As long as the chemists that are behind these products can make it that potent. You just add more and it gets more potent, right? So we did a lot of research on this. We did a lot of community scans, and we said, okay, we are not going to allow this to be sold to kids under 21 in Wood County. So we went to a couple of presentations. We gave presentations to our county board and a couple of other community groups and just shared, this is what we're finding. And county board actually asked us to help draft an ordinance at that time. And we looked at best practice from the alcohol industry and tobacco, where you have to be 21 for a reason for these products. There's not a lot of research behind this intoxicating hemp yet because it's newer stuff. It's chemically made and added, so we don't really know a lot about it yet. We're kind of the guinea pigs at this point. So we kind of took best practice from alcohol. You're not allowed to sell it within so many feet of a youth-friendly location. So we said, let's put that in the ordinance as well. You cannot sell intoxicating hemp within 750 feet of a youth-friendly location, such as a playground, a school, a daycare, that sort of thing. So 2022 is when Wood County passed that ordinance. And that was kind of like why we were presenting at the conference that Maddy was at. And I was a part of an ad hoc committee for the State Council on Alcohol and Other Drug Abuse to draft recommendations essentially to the state to say, what should we do about keeping kids safe? And that was really the focus. We want to protect young individuals. We don't want to see people who are in middle school, high school, and college age kids using these products when their brain is not fully developed, and harms can come from that. We're hearing from community partners, such as individuals who work at the Norwood Healthcare Facility, saying they are seeing individuals with no family history of mental illness with showing signs of psychosis, and it's increasing rapidly. And just hearing from all of these partners about what they're seeing, the schools, with how much they're seeing in the school system, it was frightening. So we made sure we passed that policy, and now you're hearing now that it's probably going to change at the federal level again. They actually are closing that loophole that was created in the Farm Bill. but I'm not really sure what's going to come of that. We're keeping an eye on it. There's also legislation proposed here in Wisconsin about placing an age restriction on it, and again, it's not signed into law yet, but we're just keeping an eye on that. But we were really the trailblazers there and wanted to make sure other communities could work on this as well, to make sure people understand that there is an issue that we're seeing with this, and we want to make sure we're keeping people as safe as possible. We don't want to continue seeing these issues that are cropping up in the communities. So,
Thank you, Ashley. Kind of noticing a pattern here. Our speakers and our guests are very humble about the work that they do, but it's truly incredible to hear about their work because it is so groundbreaking, especially with rural healthcare barriers, seeing that increase in mental health, substance use, seeing those needs in our communities. We're really proud to have these professionals here with us this evening. So at this time, I'd like to open the floor to our audience. We have a microphone runner. They'll deliver the microphone to you. So please raise your hand nice and high whenever you have a question. We hope to get to as many of your questions as possible. We're doing good on time. For this question and answer session, please tell us your name, your year in school, and then your major or the career you're interested in. And then you may direct your question to the individual or toss it up to the panel. So feel free to inquire about any of the programming they work with, their career experiences. Use this time wisely. For our virtual participants as well, feel free to pop a question in the chat and we have someone monitoring that and we will ask it for you.
Anybody have a question?
So remember your name, where you're at in school, your major, and then let us know your question.
I'm Morgan. I'm a junior and I'm a double major in psychology and communications. I have just like a general question. I know a lot of you said that your day-to-day work is different. Usually, how do you kind of face that ambiguity and like feel confident doing things that are different from what you know?
Yeah, so how do we face the challenges of having some days look different than others? Give us some tips there. Anyone can go ahead and grab that.
So yeah, every day is differently, or there's a different beast to tackle. But it's kind of like at least for social work and case management, it's the same foundation. The people I work with, they obviously have their own unique needs and challenges. So yeah, some days I really don't know what's going to be thrown at me. But again, like with schooling and stuff, have a pretty solid foundation. And people do, someone could be sitting across from me and they say something completely out of left field, and it's just kind of rolling with the punches at that point, if that makes sense. But yeah, it's like the same foundation, I would say.
Yeah, thank you. What about some time management? Or I see some.
Yeah,
go ahead.
We got a lot of people who want to answer this one. We have some work plans for whether it be for a grant or for our community health improvement plan. We have work plans with timelines on it, which is super helpful, but also looking at your calendar. If you have a meeting coming up, you kind of know you have to schedule things to get done. So that kind of helps know what needs to get done from day to day. If I have a Narcan training, I know I better be preparing for that. Or if things just don't seem to be getting done on our work plans that we have, that's when maybe we have an internal meeting and talk about how can we address this. If things come up in a community meeting that are brand new to us, we can kind of go and, you know what, we don't have an answer for that right now, but we'll look at it, we'll research it a little bit more. I know I just went to Paula this last week about different dosing for Narcan for 3 milligram versus 4 milligram, and I was like, what do we know about this? What should we say to our partners who are interested in using this different variation of the naloxone? So yeah, there's all kinds of things, but I love relying on my community partners, and they're the experts in their fields. I can't be the expert in anything. I got to rely on my community partners as well. So.
I think Ashley did a good job of highlighting the need to prioritize, and I think that it boils down to that a lot when you have a lot of responsibilities and pretty much everyone up here is pulled in multiple directions. We all have multiple roles. We're all on multiple committees. You have to prioritize. If a grant report is due tonight at midnight, that's what I need to do today. But ultimately, it kind of turns into, and you see one of two things a lot. But I have always struggled with this idea of, I try not to say what is and what isn't my job, because everything's my job. If it needs to be done and it's going to help someone, you have to do it, and you have to figure out a way to make it happen. And there are a lot of holes, or a lot of things that come up that really don't belong to anyone. So part of how I deal with that, and that I think you used a good word when you said the ambiguity of it, is that I go into every day knowing that something's going to happen that I'm not expecting, but that something is going to have to get done, and it might not be anybody's job. So, again, it kind of goes back to something Emily said before too, about you need to be open-minded in this world. And if you have an open mind, it's incredible how much you can accomplish. And if you're willing to put that out there and take those steps to make things happen, you just kind of have to view everything as your job, but you also have to have the ability to prioritize.
I think when you work with people, you can't be rigid in your expectation that you're going to start your day at 6, you're going to do this at 7, you're going to do this, and you're always going to get a lunch. You will soon realize in your career that lunch isn't always at noon, and there's going to be meetings and things like that. I think what helps me is when you're one-on-one, or even in a small group, you talk to the person in front of you, and you really think about individualized care. Somebody had said that every person is unique, and you can't cookie cutter when you're dealing with human service occupations. You have that foundation, you have that general knowledge, you then individualize it to the person sitting in front of you, because you may walk in and think, oh, this is an opioid withdrawal, and I can get them started on Suboxone. They're going to feel great in a couple hours. I'll let the jail staff know, yep, medically clear, they can go up to general population. And then they say, I really feel like killing myself. And then that totally shifts your plan, because not only do you need to deal with like your opiate withdrawal, you then need to bring in mental health, and you need to make sure they're safe. And I know I've been supposed to be in meetings with Ashley, maybe even today, and I have to say, I'm on my way, I'm late, I've got somebody in withdrawal. And for me, that's my priority, is the person's medical needs. I can always catch up on a meeting and talk to people later. So I think also understanding your colleagues and what their responsibilities are and how you can all work together. Human services is a very hard area to silo. As Dillon said, it's not my job doesn't work real well when you're in the human services professions. We all need each other to make the world a better place, or help make it a better place, and provide people hope. In admitting that you don't know everything is big. That, hey, I need to reach out and talk to my partners about this. Let me get back to you. Let me do some research. Particularly in the criminal justice area, you can't make stuff up. You can't buffalo. When I had students, and Susanna can talk more about that, but you're being genuine and being honest goes a lot further with people than trying to make it up. That fake it till you make it doesn't work. Once you violate that trust, you'll never get it back. And I would tell students who I have with me, I have a lot more respect for you if you tell me you don't know than trying to fake it. And depending on where you end up, it could be somebody's life or death decision if you're trying to fake it.
So my job, I always say, I come to work, I have no idea what I'm walking into. Sometimes I'll get a text, but it's more along the lines of just putting out fires. And I like that. It's challenging. There's things coming at you. You just have to problem solve continuously throughout the day. And yes, it does have to do with staff. And then you have inmates, and they have whatever challenges that they're facing, whether it be getting them to a treatment center, whether it be they're having a crisis right now, we need to address this issue, or, you know, where sometimes we need some different medications and we have to figure out a way on how to get that person to a specialist to be able to, you know, get the medications that they need. So it is prioritizing a lot during the day. It's just challenging and it's very interesting, and that's probably the best part that I like about my job. Just being able to help people put out fires and just keep moving. So it's fast paced. You know, it's never, we say this all the time, no day, you know, no 2 days are the same. You might have some of the same issues come up, but you dealt with them yesterday, so you know how you're going to deal with them today. So you, and you rely on your coworkers, everybody to come up with the best solution.
Yeah, some of the common themes there, having that strong foundation, like Emily talked about, relying on what we're learning right now and in internships, utilizing our time management, collaborating, prioritizing, and then also giving ourselves and our team members some grace. Really important piece there. Next question.
Hold on. Who did it first? I don't know.
I'm Haley. I'm a freshman, and my plan is to major in social work and minor in addiction studies. And I don't even know if you guys can fully answer this question, but is there a time that's too early to shadow and do internships? And if it isn't, how are you able to get in contact to be able to shadow somebody?
I guess, Haley, to answer your first question, no, I don't think it's ever too early to shadow. I mean, there are no negative consequences to experiencing it. And when I hear the word shadow, that's what I'm thinking of, is you're going to go spend a day with someone and you're going to see if it's something that is interesting to you, that somehow might be something you want to pursue. A lot of different agencies have different rules about internships, so I don't know. I know for my department specifically, I would never say no to someone that wanted to come and experience what we do on a daily basis. So I would be open to high school level. I'm guessing they'd have to be over 18, but that would probably be my one limitation. I would encourage anyone to experience as much as you can. It's really hard to grasp the big picture of this system, or I mean, you have a general idea of what you want to do, but if you don't know exactly what you want to do, the best way to find out is to experience as much as you can, because everything you experience is going to shape your perspective and it's going to help you get to where you need to go as far as making the word has escaped me now, but a decision that's rooted in something more than a gut feeling.
And then when you come to finding those experiences, I think, Emily, do you want to take that one? How do we find our job shadow and internship experiences?
I also wanted to touch on for social work, I don't know if you know, but you're required to do an internship your last year. Yeah, so your senior year, you'll be required to do one. So instead of a capstone project, you'll do an internship. And I think it's I forget her name. One of your professors will help you. You can pick wherever you want to go, and then they'll coordinate that for you. So you have that to look forward to. In regards to job shadowing, just reach out. When I started my undergrad, I enjoyed reaching out to people. I reached out to the drug court for Portage County, and I was able to sit in for their staffing for a day in their court. So I would just reach out to people. Our office had 2 students reach out just this week, just to chat, and a common theme, at least when I was reaching out to job shadow people, everyone is really excited to bring people on too. So I would just reach out. And with internships, I've never done an internship before my required one, but just starting that job shadow could kind of kickstart that process too. my supervisors share that we're an academic health department, so we do work with student interns quite a bit. I don't know exactly how that process looks, but anyone who is interested in doing an internship would be able to work with our health department if that's an interest. I shouldn't say anyone, you would have to apply for your internship, obviously, but we have worked with UWSP for the last several years, and one of the programs or the projects that we have come up with is actually around the hemp derivatives work. So we actually had 2 UWSP students do our community scans, and they called a bunch of our retailers to ask if they sold hemp products, and they went into some of the retail establishments to do that community scan to see, do they have signage for how old you have to be? Do they market it to youth? Like, do they have colorful packaging? What kind of products are being sold? That sort of thing. So we have done that for the last few years with UWSP. We also do a lot of coalition work. So anyone who's not familiar with community coalitions, I would encourage you to look into that, because Stevens Point does have a substance use coalition that you can be a part of. They invite any community partners, including UWSP students, to be a part of that work, I'm sure. So our work in Wood County is through Healthy People Wood County, and the substance use arm of that is Impact. We have another substance use prevention coalition in Marshfield. The acronym's MACY, the Marshfield Area Coalition for Youth, and we invite anyone in the community to be a part of that work. So that would be more of a volunteer opportunity, but you could also kind of put that on your resume too when you're looking for future careers, that you've been a part of this community coalition working towards this common goal. So that would be an excellent opportunity. And we also are looking for individuals to do compliance checks all the time. So there's like different opportunities that way. So I would just encourage anyone who's interested in getting experience to think about volunteering as well in any sort of capacity. So.
Yeah, it sounds like there's some great opportunities in Wood County. It's only about 20 minutes to Shadow from here on campus, but on the pages you grabbed as you walked in, and if you didn't get one, there's a stack on the table. The emails for our panelists are on there, so don't hesitate to reach out, and they'll also be around for a few minutes after the panel if you want to introduce yourself personally.
Okay, sorry. I'm Molly. Right now I'm pre-PT, but I'm thinking about changing it to social work. And my question is, how do you hide like your own emotions from a patient or client? Because I feel like I'm the type of person to have a good cry session with somebody. Like if they started crying, I would then also start crying.
I guess I can share an experience I had. I was very young, and I had responded to an ambulance call. It was a code. We got a pulse back, and the family didn't want to transfer to a tertiary care facility. They just wanted him to die at home base at the hospital there. And I worked the ambulance call during the day, and then came in on the night shift as a nursing assistant. And they recognized me from being at their house, and it was very emotional. And the nurse that I was working with, I talked to her later, and I said I couldn't help it. I just started to cry. And what she told me was, it's okay to share those tears as long as you don't cry harder than the people you're trying to help. I think it makes you real. It makes you, it lets you show that connection. I think as you grow in your career, I think it's very important, particularly in this line of work, to be the no judgment zone. And you need to work through your own bias and stigma, and it may be that there's just areas where you can't shut it off, and that may not be an area that you work in. You need to find where you're comfortable. And I think also finding a good mentor to help process and role model for you is also very critical. I have one. I mean, she's retired now. I still give her a call every once in a while and say, oh my gosh, what do you think? Without divulging, identifying, respecting HIPAA, but in general terms. So having a good mentor, checking your own awareness and what your own biases are, and working with them.
And I can touch on kind of the vulnerability piece too. Like I mentioned earlier, I thought I was going into education, working in an elementary school. For me, what I had really found was that I struggled with the separation of work and home. I was 17, 18, 19, leaving job shadows, work experiences, internships, just feeling tired and exhausted. I was emotionally weighed down. I'm crying for these kids that I care about so much. But learning our professional boundaries. For me, that professional boundary is understanding that I can work with kids and do really well and love what I do. But for me, being able to separate that, I found that I just really jive with adults. Being able to impact someone and mentor them in that way. For me, it came down to that professional boundary. And as I get older and grow in my professional experiences, I might find myself working with kids, but using those tools, our mentors, our peers, to be able to consult with others, to set that boundary, but really just getting those job shadows, those hands-on experiences. You'll find that your vulnerability will be your superpower, but also learning those tools to navigate that. Thank you.
My name is Lily, and I'm a university transfer, so it's my sophomore year here. I'm going into nursing, and my minor is in neuroscience and behavior. I wanted to first just say thank you for sharing all of your different things. I appreciate the different careers on the panel and the opportunities to see the way you guys all interact together. It's really helps a lot. I was initially interested in talking to Paula since you are a nursing major and that's the field I'm interested, but I guess anyone could answer. I worked a lot of my summer and was very lucky to come straight out of high school and get a job at a mental health facility. I saw a lot of the ways that the emergency intervention and mental health careers work, but I was interested in the differences and similarities as you might see in corrections or in the jails when you experience those behaviors and the way they were handled and the duties and the different career paths. It's kind of a loaded question.
I'm trying to sort out exactly what you're looking for.
Oh, yeah, sorry.
But I guess you have to look at the situation in front of you kind of as the totality, okay? And then kind of piece it apart. I think, particularly in corrections, it's the safety. Safety's first. Treating addiction and mental health. I think you can have a mental health diagnosis. You can have anxiety, you can have depression, you can have fear of flying, things like that. But when a person has a substance use disorder, that many times is so intertwined that you need to look at both. I'm not certified in mental health. I have a generalist approach to it. Even when I did primary care, I would treat basic anxiety, depression, things like that. But when it came to diagnosing the more complex diagnoses, schizophrenia, bipolar, those types of diagnoses, I would always refer out to a specialist. As I got going in addiction medicine, one of the medical directors I worked with, he was a psychiatrist and he would not treat anybody's psychiatric diagnosis until they had sobriety for about 3 months, unless it was debilitating. Because many times the behavior that you're seeing in front of you is a result of the substance. Okay? I'll put a book title out here for you. It's called Healing Mean. Written by Tunir Kane, and I've actually had the opportunity to hear her speak. And she began her substance use when she was 8 years old and was involved in the criminal justice realm along with CPS, foster care, you name it. She had it all. And she described her mental health diagnoses as it depended on the day of the week, in which facility she was at, and which providers were on. She talked about Manic Monday, she talked about Bipolar Tuesday, and whatever day of the week, and then whatever substance she was on was what her diagnosis was. And I worked with people, they're like, I need something for my anxiety, I'm so anxious, I'm so anxious. I'm like, when did you last do math? Well, yesterday. You're gonna be anxious. Really? Math makes you anxious? Yes, it does. And that was a direct quote, I did not make that up. And part of what you're going to do as a professional is help people understand what's going on with them. There's been some research that's come out recently that says 40 to 60% of the reason a person has a substance use disorder is because of their genetics. And helping people wake up one day, here you go, there are actually receptors in your brain, there's your genes, there's what has been socially acceptable around you, your environment. There's so many different things that play into that diagnosis. And people's reactions, how well they can control their own emotions. So I hope I'm getting to what you're asking, is that number one is safety for all of us. Safety for the person we're working with, safety for us, because if any of us here at this table or anybody in uniform gets hurt in the interaction, we're kind of out for a while. So I'll let you respond with another question.
No, that did answer a lot of my question. I was really also just curious in the way that you guys like the interventions you guys use and like your daily duties compared to someone like in your emergency setting. Is it, you said you work in like EMT and like emergency room. I was curious what the difference is in like or similarities, if any, between corrections and that. I said it very fast.
I think she's asking, kind of talking like crisis intervention, de-escalation, how these different employers collaborate, work together. What are the differences between being out in law enforcement responding, or being in an emergency room responding, or being within the jail? Can you elaborate on kind of the differences there?
I'll take a little bit of this. There's a lot of folks with like the human services major with a minor in communication. This is going to play into Professor Tim's world. The ability to communicate, and we also need to remember that at least half of communication is listening. Understanding where people are at, what they're thinking, and just listening a lot of times. I mean, I've sat on the floor in an exam room with somebody who couldn't even look up, and again, there's some cultural things you need to watch out for, but for me to be able to see their face and what was going on, I sat on the floor so I could listen to them. And pretty soon they were making eye contact, and then we could really keep moving ahead. But it's that ability to communicate and understand. And again, safety is number one. We all have to be safe while we're doing this, not put yourself in a position where you're at risk. Knowing where the panic buttons are, things like that, putting yourself between the door and the person you're working with, things like that. But a lot of it's listening, de-escalating, and I see a lot of that more and more. I mean, my career in EMS started in 1985, okay, a long time ago. And hearing and watching now the corrections staff, law enforcement, it's a whole different ballgame where it used to be kind of the old cuff them and stuff them, where now there's a lot more dialogue and a lot more work being done. And it is hard work. At the end of your day, sometimes you're just plain old exhausted and you didn't run a race. It's that mental, emotional taxing of your day.
I'll share if Becker wants to that.
I think that I can't answer for Paula about how it is different, from an emergency room or that kind of environment to a jail. I can tell you that the jail has a lot of more rules, restrictions, guidelines, Wisconsin, the state statutes, federal laws that we have to abide by, but we still try to fit in, the services that can be, that can come into the jail. I think, like she said, in the last, I really noticed a difference since probably 2014 of did. We used to have the drunks that would come in, they would come in fighting, and then they would sober up and then they would go home, right? But now it's more of, it's the mental health aspect of it. We're meeting their needs when they come in, you know, if they need to be seen by mental health, if they need medical, if, you know, maybe they need to be taken back to the hospital and maybe medically cleared before they come in. It's each individual that's coming into the jail now is being evaluated by our officers, you know, just to make sure that their immediate needs are being met. And a lot of these inmates that are coming in are in crisis mode right away. So we have to deal with that. And I think that's along the same lines of the emergency room. But I feel that nursing, I think they are dealing with the same kind of things that we are in the jail.
Does that help?
Yeah, no, you answered
Yeah.
my question.
Thank you. All right, other hands.
Hi, I'm Aspen. I'm a freshman, and my major is family consumer science and a definition in like child life. And I guess it's sort of more targeted towards you, Paula, but have you like, while working in the hospital, did you ever work with child life, and has child life ever came into the jail, or like, I know it's children aren't in the jail, but like, has that ever like crossed over or anything?
Yeah, I can address the child life. Again, I never passed meds until I came to the jail, so I was always like an ER nurse. And then my practice for the most part was in urgent care settings and things like that. And when I did primary care, it was adults. So I can address where we use child life, and that was any sort of scary procedure. They would come in, they were amazing at distracting kids and helping them kind of work through those emotions. And sometimes I would just wait. I mean, it wasn't anything life-threatening at the moment, and called child life. They work through a lot of the pure emotion, just the raw emotion, and working with the parents as well. And I always had a good working relationship with child life because I would just come in, simply talk and explain what I was going to do, why it was important, things like that. Some of the advances that helped, because face it, gravity has a lot of impact on a kid who's learning how to walk and what their limits are. And we did a lot of suturing and taking the needle out of things and being able to put different compounds directly on the wound and numbing it up was a whole lot less scary than, hold still, I'm coming at you with a needle, okay? I know one of the jailers and I have been talking, and the CO in particular has a history as a kindergarten teacher, and she's like, you know, you bring all those books in for inmates to read, and we didn't get a chance to talk about this yet, but what do you think about bringing in some kids' books so that when they're doing their video visits with their children, they can read to them? And, you know, those types of things. And I know, I don't even know who brings them in, but I see when you come in the hallway, there's books for people to take to read with their children who have parental unit or somebody incarcerated, so that there's a little more understanding there. To cover it.
Yeah. I also sort of have like another question. I don't know if like you guys have like worked in like juvie settings or anything, but like with like substance abuse in younger children, do like different professions ever like, I don't know, come in and like help with that?
Absolutely. I can elaborate on that one a little bit. I'm currently completing an internship with Rogers Behavioral Health up in Wausau. There we do partial hospitalization programming and intensive outpatient programming. That is day treatment essentially. So patients are in the care for either 3 hours or 6 hours a day, about 5 days a week, for about 8 to 12 weeks. It's that you can still be in your home, you go home and sleep, but then you're in that controlled environment during the day. I work primarily on the adult wing, however, have shadowed on the adolescent wing. And there, kids they come in, have that structure, the substance use treatment, the counseling, the time to do school in a controlled environment, the groups, right? Talking life skills, communication, that kind of formal treatment. So that can be done in like that hospitalization setting. Outpatient care is always there. But also just last week I was down in West Allis at one of the other Rogers Behavioral Health hubs, and they have a adolescent residential recovery unit. And they're obviously Milwaukee area is very different than up here, but they have they see a lot of substance use in that 14, 15, whether that be substances like nicotine, marijuana, but even seeing, unfortunately, some adolescents using heavier drugs than those substances. So that residential treatment where they can live at the facility for approximately a month, get the similar care to the PHP IOP day treatment, but then step down with that support with the ultimate goal of being able to stay sober, have those mental health supports, caseworkers, social workers, community supports, family, friends, kind of building your resources through those. So there are, outside of juvenile detention centers, there are medical facilities that are working towards helping youth and adolescents with substance use.
And I think just to kind of add on to that, I think the awareness of actual use, even in our elementary school children, we need to start talking about. When I talk to the adults, I ask them, when did you first use? Whether it was sneaking a drink of beer out of someone's glass or your first cigarette. And when you talk about how do you hide your own emotion, when you have somebody tell you, I think I was 5 or 6 the first time my parents shot me up, you got to hold that in. And then also realize that substance use is starting very young in our communities. And I think there's a lot of our own stigma that NIMBY, not in my backyard, oh, this is central Wisconsin, this doesn't go on here. That awareness, we need to be aware of what's going on and understand that it does happen here and be a resource. And I talk to parents about, you need to talk to your kids. If you don't have kids yet, when you do have kids, you got to talk about this, because that 40 to 60% you can share with your children. And we don't have a problem saying, heart disease or diabetes or whatever runs in our family. We need to make sure we're eating right and exercising and all of those things. We also need to be talking about, mom has a problem with filling whatever substance, and you need to be very careful. Like, you probably should not even experiment with it, because these things can happen. And once you wake up those receptors, sometimes they're very hard to shut off.
Thank you. We got a hand over here.
Yeah, my name is Kevin. I'm a psychology student in my junior year. My question is, working with humans isn't always puppies and rainbows and sunshine. So when you do experience something or hear something or told something that is disturbing or borderline traumatic, what do you do to process that? Who do you go to? Who do you talk to? What do you do to work through that?
Yeah, such an important question there, kind of talking about the work-life balance of it, overcoming stress, kind of having that resiliency as a professional.
So I'm pretty new to the field, and people have said some new things to me, for sure. I would say right now, I focus on just leaving it at work. I have a work cell phone, so participants can contact me at any time of the day if I look. So I check my phone maybe once in the evening, and if I had a really tough day, I'm not looking at it at all. Like, if it's a true emergency, they'll call 911. I can't fix everything. It's kind of my perspective on things. And also, if someone's right across from me and it's just heavy, acknowledging their feelings. But you're also human too. So if you need a break, you can always reschedule someone else's appointment, and just take take care of yourself during those moments. And luckily, our office, the criminal justice department, is pretty small. There's 4 of us, so usually if someone leaves the office and there's a heavy conversation, we can always pop over to the next office, kind of talk it out with the coworkers. So, but yeah, definitely prioritizing taking care of yourself first, and it's hard, especially when you're working with people and you really want to support them, but you can't support them if you can't support yourself. So.
I can tell that Emily works in my office because these are the things. So when I talk to peers about this, that's the first thing I always recommend is being able to compartmentalize. When you're at work, obviously we work with individuals who have experienced a significant amount of trauma in their lives and have a significant number of life experiences that could trigger emotions in anyone that's talking to them about it. And I really stress the importance of being able to compartmentalize that and to rely on your peers. And I'm a big, I guess, advocate for that idea of peer support. If Emily is having a bad day, I want her to know she can come talk to me about it. She can go talk to Sterling about it. She can talk to anyone in the department about it. We all have experience working with the same population, and sometimes that can just help to have a conversation with a coworker about it, kind of debrief it, and then when you go home. And that's kind of what I always recommend to people is we have a role in our work life, but we also have a role at home, whether that's as a partner or as a friend. So really focus on those roles when you're not at work, and focus at your role when you are at work. And I feel like you naturally can adjust to that if you look at it with that mindset. And then I would also recommend that if you ever do experience something that really does affect you, you can always seek professional help too. And that's something I've had to do at different times in my career. And what I found is if I'm talking to a client whose story is really close to home or very similar to something I've experienced, it can trigger my own past. And I personally have found that having some sort of either a therapist or a counselor in the community can be incredibly helpful with that, because that gives me a safe place to debrief whatever it is that I haven't come to terms with that's now been triggered by someone I've been working with.
I think finding that person who can hold you accountable for keeping that separation. I will admit I have heard from a couch in my living room, "Are you over there working?" And just being able to separate work and home is sometimes difficult, particularly for those in leadership positions. Susanna pretty much has her phone on all the time, I think, and she's my sounding board. Sometimes I need it because I don't know what all the jail rules are, but then we've also found a common ground of our animals, farming, things like that. So having that separation, and I know when I was excited, still am excited about my work, but when you're new and you're working and you're afraid that things may go wrong or what you're doing may be a burden for somebody else, and you're like, yeah, I'm going to pass meds on the weekend too because I don't want to put this on somebody else. And then there's this little voice on the other side of the desk that goes, how long is this sustainable? And you can't be burning yourself out, because once you burn yourself out or you become physically sick because you've been working so much, you're not a good help to anybody, particularly yourself.
All right, other questions?
Hi, my name is Emma. I'm a sophomore, and I'm studying psychology and minoring in creative writing. And personally, I'm looking to be like a mental health technician or some sort in like inpatient setting or residential. And I know for myself and for a couple of my friends who are interested in the same thing, they've gone through a lot of trauma. And I'm wondering if like, whether from personal experience or like fellow coworkers or just like friends and family, like at what point do you think like you were ready to
this field of work, depending on your own trauma or like what you've gone through yourself?
It's kind of a loaded question. I guess for me personally, I would say, and I tell this to people on a fairly regular basis, I think the more that you've experienced in life, the more you are equipped to work with people who have experienced a lot in life. And I will say that until I'm blue in the face in some social circles, but I do believe that people who have experienced trauma, people who have are the most qualified to understand individuals who experience trauma. Same with grief, same with addiction, same with anything. Someone who has lived experience has an invaluable asset to that conversation. So I guess as far as when you think, when you realize you're ready, I guess that's kind of up to the individual. And I think a lot of it comes to when are you at a point where you can prioritize the other person and make sure that you're giving them the service they need. I think it's incredibly important to be able to relate to people. But you also have to be able to meet people where they're at. And I think sometimes when people have experienced a tremendous amount of trauma or not, or even if it's just a relevant piece of trauma with someone else, they're going to look at it as, well, this is what I did, or this is how I did it. And everyone's path is different. So I think once someone has the maturity to understand that regardless of, I think having that lived experience and being able to relate is incredibly important. But I think having that maturity to be able to still meet the person where they're at and identify what they need, I think once you are able to do that, I think that's awesome. And I think you're in a position where you should do that because you have that gift of relatability and you have that gift of truly understanding what someone is experiencing. But then you have to be at a point where you're able to still put that person first and not I forget what the word is, but project your stuff on them.
My mentor was very good at recognizing her employees' traumas. And the one thing that she taught me is that you've got to be good with yourself first before you can go out and help people. Otherwise, it's very easy. And the phrase that she used is to go down the rabbit hole with them. You need to be able to be standing at the top of that rabbit hole and hold out the hand to help them. So I think that's, everything Dillon said is incredibly important. That's why organizations like Three Bridges Recovery is so beneficial to so many people, is that lived experience, and that peer support specialists, recovery coaches are an amazing, amazing asset to our team. But when somebody is either triggered themselves or they haven't healed enough, they're not ready to help.
Thank you. Are there any final questions before we wrap up here? This will be our last one.
Hey, it's me again. Again, I'm pre-PT right now. My name's Molly. I'm a freshman, but I might switch my major to social work. This is more targeted towards Emily. Do you work closely with other social workers? Like, I'm interested in more CCS or independent living services. I guess, who do you all chat with?
Yeah. I do work with CCS now with one of my current clients. So it's kind of a big web. Like directly in our office, one of my coworkers for the Strong program, she graduated with a degree in social work. My other coworker had a sociology degree. So day to day, I don't interact with a lot of social workers, honestly. But I think it's very important with my role to kind of emphasize those social work values too. But yeah, with interacting with social workers, I would definitely say it's just through my clients and what they're involved with, if that makes sense. Like today I talked to a social worker from Norwood and we were coordinating a discharge, and then with CCS it's making sure meds are being delivered to the right place, and then with CPS making sure that they're are completing what they need to do with CPS, and how can drug court or the MAP program kind of help with that. So not directly a whole lot. There are different departments that are full of social workers, but I think that's what's really unique about my position is everyone who's on our team has a different perspective. So yeah.
All right. Thank you everyone for engaging with your questions. Tonight has been a really valuable experience learning from our guests about their educational experiences, job opportunities, and unique programming in Wood County, and to explore the human services career field. To conclude the evening, I have one final question for our panelists. Please describe the impact of your daily work in one word. So please describe the impact of your daily work in one word.
Rewarding. Steadfast.
Systemic would probably be the word I would choose.
Hope. I'd have to go with rewarding also.
Thank you. Rewarding, steadfast, systemic, and hope. Throughout the panel here, I've been also taking notes of some of the different big takeaway words. Connection, people first, support, communication, community, partnerships, coordination, teamwork, resources, education, overcoming barriers, patience, open-minded, and vulnerability. I want to thank our engaging audience for attending this event, exploring careers with us, and considering entering this rewarding field. Another shout out goes out to NAMI on campus and the PR campaigns class for supporting this initiative. Thank you, Sheriff Becker, for providing us with a warm welcome and sharing your Pointer spirit. To our panelists, thank you for taking the time to share your robust experience and answering our many questions. I'm very appreciative of those who helped me plan the event, those in attendance, and our guests for joining us. Thank you for those joining us virtually too. I strongly encourage those looking for job shadow opportunities or internships in the local area to reach out to our panelists for the potential opportunity to explore more in Wood County. Our panelists will be sticking around for a little bit after the event if you'd like to introduce yourself and ask any final questions. Lola would love to meet you too. Thank you again for your time. Also feel free to stop by the NAMI on campus table for some freebies and swag. Have a good rest of your evening.